I want to talk to you a little bit about some of the perioperative interventions that I utilize to improve the quality results with my patients. I think it's really important to understand that good plastic surgery isn't just about good surgery. It's also about the things that we do before, during, and after to improve the quality of care of the patients. There are several things in my practice that I utilize in order to improve the results for my patients. So I want to talk about a few of those with you right now. The first is important. It's regarding nutrition. I utilize a perioperative nutrition supplement to improve wound healing in the initial phase and after surgery. It's basically a shake that you drink 5 days before and 3 weeks after. It's not expensive, but it has been clinically shown to make a big difference in terms of wound healing and recovery. And that's because it contains collagen, arginine, glutamine, and other key factors for healing in the healing process. It does make a big difference, and that's why I utilize it in my practice. Another thing that I like to use with patients is hyperbaric oxygen chamber treatment. I absolutely require it when we do fat transfer or facelift, and I suggest it very strongly to all other surgical patients. Why is that? Well, because hyperbaric oxygen chamber treatment helps to modulate the healing process. When you've had surgery and skin has been elevated from its blood supply or fat cells have been transplanted from one side of the body to another, the first thing that they do is cry out for oxygen. And they do that by secreting inflammatory factors. So if we give your body the oxygen that it needs, 3 things happen. The first is that the inflammatory signals go down. So inflammation and swelling becomes much better very rapidly. The second thing is that the tissues that are crying out for oxygen do better and they survive better. This helps to improve the quality of the yield with fat transfer and improve skin healing after facelift surgery. The last thing is that those oxygen molecules help to improve the breakdown and the metabolism of secondary metabolites from anesthesia. So patients feel better on the inside. It helps to get rid of that post-operative kind of grayness or grogginess that patients experience. That's why hyperbaric oxygen treatment helps to improve the quality of the result. Another thing that I like to utilize with my patients is lymphatic massage. So when I do body surgery or surgeries that involve large areas, lymphatic postoperative massage helps me to improve the quality of those results. Why? Well, for instance, liposuction. The biggest complication with liposuction is something called a contour abnormality, which is a lump or bump that may bother you after surgery. What is that caused by? Well, after surgery, there's swelling that occurs in the tissues, and that swelling is lymphatic fluid trapped within the soft tissues. We know through other research in lymphedema and lymphatic problems that if lymphatic fluid sits for a long time, which is called stasis, that triggers secondary inflammation pathways. So if we move the fluid out from where it is, it reduces the risk of secondary inflammation and something called fibrosis, which is scar tissue that can occur much later on. So when we do lymphatic massage, that helps to move the swelling out of the tissues that have been operated, and that reduces the risk of secondary inflammation and fibrosis or scar tissue, which can create those soft tissue irregularities or contour abnormalities. That's why it's absolutely critical to the quality of your healing. That brings up another important concept, which is compression. So I utilize compression garments after surgery in order to help to keep that fluid out, to help complete the compression, to help reduce the lymphatic fluid that's there. And again, this helps to improve the quality of the result by reducing secondary inflammation, lymphatic stasis, and fibrosis or scar tissue later on. So these different interventions all help to modulate and improve the quality of healing after surgery. They're all evidence-based and they're all highly recommended for patients undergoing breast, body, and face surgery. One other supplement that I like to utilize around the time of surgery is a supplement called Heal Fast. It's an interesting supplement that's been created by doctors and other people that are essentially scientists in the field of surgical and post-surgical medications. This nutrition supplement has only scientifically backed products. So all of the nutrition supplements contents are products that have a scientific article or a peer-reviewed article which support the use in the pre- or post-operative time phase. It's really important because it has important cofactors like collagen and other important cofactors of wound healing, and it has been shown to improve wound healing after surgery. You take it in the immediate month right after surgery, and it makes a big difference in terms of swelling and in terms of healing for patients. One of the important topical medications that I like to utilize after facelift is called Elastin Nectar. It's basically a product that's been designed for before and after the use of a laser or an energy-based treatment. It's got medications in it that actually penetrate the skin to help prepare it for an energy-based treatment and help to turn over the elastin, which is the stretchy component of the skin. It's been scientifically proven to improve the quality of your skin after a laser and to improve and decrease the healing and downtime after a laser. And I really like to utilize a product because I was a part of the initial clinical trials that showed that there was a difference in wound healing. It's a state-of-the-art company with a state-of-the-art product, and we like to utilize it because it is a real medication that improves the healing after facelift and after laser or energy-based treatments. One other important post-operative intervention is the use of a scar cream. So we utilize silicone-based products in order to improve the moisture content and the temperature of the area where the incision was. This helps to remodel the incision to take it through a process of healing. Early on, after your incision has been made and is healed, you'll notice that initially it looks really good, and then over the course of the next 4 to 6 weeks, it may become upraised and reddish looking. That's actually part of normal wound healing. That's your body bringing a new blood supply to the area of the incision to help remodel it and to strengthen the soft tissues that are there. It's important for me to make interventions early on, like the use of a silicone scar cream or a silicone tape in order to improve the quality of healing. I may also need to make an injection of a certain medication in order to reduce the amount of scar tissue formation that's there. Scar creams and scar tapes are utilized for up to 3 months after surgery. In rare cases, we do another intervention, like another injection at a later point in time. But these silicone-based products are really the only scientifically backed or evidence-based product to improve the quality of healing of the incision over time.